Are you living with type 2 diabetes and finding it challenging to manage your blood sugar? What if there was a treatment option that could not only help you lose significant weight, but also potentially put your diabetes into remission? A major new study funded by the National Institutes of Health, NIH, has exciting long-term results about bariatric surgery for type 2 diabetes. Type 2 diabetes is a chronic condition affecting millions. It impacts how your body uses sugar, glucose, for energy. Over time, it can lead to serious health problems like heart disease, kidney damage, and nerve issues. Managing type 2 diabetes often involves diet, exercise, and medications. For many, achieving and maintaining healthy blood sugar levels remains a significant challenge. This is especially true for individuals also living with overweight or obesity. Bariatric surgery, also known as metabolic or weight loss surgery, involves making changes to your digestive system. These procedures are typically considered for individuals with significant obesity. They work by limiting how much food you can eat or reducing the absorption of nutrients. Beyond just weight loss, bariatric surgery has shown remarkable effects on metabolism. It can significantly improve how the body responds to insulin. This metabolic effect is why it's increasingly seen as a treatment for type 2 diabetes, not just obesity. A new important study provides long-term evidence on this topic. It's called the Alliance of Randomized Trials of Medicine versus Metabolic Surgery in Type 2 Diabetes, RMMS-T2D. This study was supported by the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, part of the NIH. The ARMS-T2D study is unique because it combined data from 4 separate clinical trials. This pooling of data created a larger, more diverse group of participants. It allowed researchers to look at the effects of bariatric surgery versus standard medical care over a much longer period. The original trials included adults aged 18 to 65. All participants had type 2 diabetes and were classified as overweight or having obesity based on their body mass index, BMI. They were randomly assigned to one of 2 groups. One group received intensive medical and lifestyle management. This included diet, exercise, and various diabetes medications, including oral drugs and insulin. The other group underwent bariatric surgery. The original trials ran between 2007 and 2013. The ARMS-T2D study then followed these participants for many years. Data was collected through July 2022, providing up to 12 years of follow-up for some individuals. This long follow-up period is crucial. It allows researchers to understand the durability of the effects of bariatric surgery. Short-term results are helpful, but long-term outcomes show true impact. In total, 262 participants from the original trials enrolled in this follow-up study. 166 of these participants had been randomized to the surgery group. They underwent one of 3 common bariatric surgery procedures. The remaining 96 participants were in the medical/lifestyle management group. Both groups received care aimed at improving their health and managing their diabetes. The key difference was the surgical intervention. The study looked at several measures to compare the 2 groups. A primary endpoint was measured at 7 years. Researchers continued to collect data and analyze outcomes for up to 12 years. Key outcomes included weight loss, blood glucose control, measured by HbA1c, use of diabetes medications, and rates of diabetes remission. Safety events were also carefully tracked in both groups. Weight loss was a major difference between the groups. At the 7-year mark, participants in the surgery group had lost significantly more weight. On average, they experienced a 20% weight loss from their starting weight. In contrast, the medical lifestyle group achieved an average weight loss of 8%. This difference in weight loss was substantial. Importantly, this significant difference between the groups persisted throughout the entire 12-year follow-up period. Blood glucose control is vital for preventing diabetes complications. HbA1c is a measure of average blood sugar levels over the past 2 to 3 months. A lower HbA1c indicates better control. At 7 years, 54% of participants in the surgery group achieved an HbA1c less than 7%. This is a common target for good diabetes control. Only 27% of participants in the medical/lifestyle group reached this target. The benefits in blood glucose control were durable. The significant difference in HbA1c levels between the surgery and medical/lifestyle groups remained evident at the 12-year mark. This shows that the positive effects on blood sugar are long-lasting for many patients. Achieving and maintaining an HbA1c below 7% is associated with a lower risk of long-term diabetes complications. These results highlight the powerful impact bariatric surgery can have on metabolic health. Many people with type 2 diabetes rely on multiple medications to manage their condition. Reducing or eliminating the need for these drugs can improve quality of life and reduce costs. The study looked at medication use over time. In the surgery group, the percentage of participants using diabetes medications dropped dramatically. It decreased from 98% before surgery to 61% at the end of the study period. This indicates a significant reduction in medication burden. In the medical/lifestyle group, the use of diabetes medications remained largely unchanged over the study period. This contrasts sharply with the surgery group. It underscores the difficulty of reducing medication reliance with standard approaches alone for many patients. The ability to reduce or stop diabetes medications is a major benefit reported by patients who undergo bariatric surgery. This study provides strong evidence supporting this outcome over the long term. Diabetes remission means achieving and maintaining normal blood sugar levels without using diabetes medications. This is often a major goal for patients. The study compared remission rates between the two groups. More participants in the surgery group achieved diabetes remission compared to those in the medical/lifestyle group. The study found higher rates of remission lasting up to 12 years post-surgery. This is one of the most exciting findings for patients. Achieving remission doesn't mean diabetes is cured in the traditional sense. It means the condition is no longer active and requires no medication for control. Regular monitoring is still necessary. Sustained remission can significantly improve long-term health outcomes. It reduces the daily burden of managing diabetes. The study shows bariatric surgery offers a much higher chance of achieving this state compared to medical management alone. The exact mechanisms by which bariatric surgery improves diabetes are complex. It's not just about weight loss, although that plays a big role. The surgery also changes the anatomy of the digestive tract. These changes affect gut hormones that influence insulin sensitivity and blood sugar control. Dr. Jean Lawrence, an NIDDK project scientist, explained that surgery affects metabolic hormones, which improves the body's response to insulin and ability to maintain healthy blood glucose levels. The greater weight loss achieved with surgery is certainly a factor. Less body fat can improve insulin sensitivity. However, the rapid improvement in blood sugar, often seen shortly after surgery, sometimes before significant weight loss occurs, points to other mechanisms. Changes in gut hormone secretion, altered bile acid metabolism, and changes in the gut microbiome are all thought to contribute to the metabolic benefits. These effects go beyond what is typically achieved with diet and exercise alone. Traditionally, bariatric surgery has been recommended for individuals with a BMI of 35 or higher with comorbidities like diabetes, or a BMI of 40 or higher without comorbidities. However, this study included participants with lower BMIs. Exploratory analyses looked specifically at participants with a BMI between 27 and 34. This range includes individuals classified as overweight or having lower levels of obesity. The findings were significant for this group as well. The study showed that bariatric surgery had important beneficial effects on HbA1c, and weight loss even among participants with BMIs between 27 and 34. This is a crucial finding. It suggests that the benefits of surgery for type 2 diabetes may extend to individuals who don't meet the traditional higher BMI thresholds. Dr. Anita P. Korkulis, the lead author, noted that these findings lend important information about the benefit of surgery in people with type 2 diabetes who fall short of the traditional higher BMI threshold of 35. This could potentially expand the criteria for considering surgery for diabetes treatment. While the benefits are significant, it's important to consider the risks. Surgery is a major medical procedure. The study compared adverse events between the two groups. There were no differences in major adverse events between the surgery and medical/lifestyle groups. This suggests that while surgery has risks, the rate of severe complications was comparable to the medical management group over the long term. However, the study did note a higher number of certain specific events in the surgery group. These included fractures, anemia, low iron, and gastrointestinal events. These are known potential complications of bariatric surgery. Nutritional deficiencies, such as low iron and vitamin levels, can contribute to issues like anemia and potentially affect bone health, increasing fracture risk. Gastrointestinal issues can include things like nausea, vomiting, or changes in bowel habits. These findings underscore a critical point. Bariatric surgery requires lifelong follow-up care. Patients need regular monitoring for nutritional deficiencies and other potential long-term complications. Proper nutritional supplementation and medical support are essential after surgery. This ongoing care helps mitigate risks like anemia and bone issues. It's a commitment required for the long-term success and safety of the procedure. This study provides compelling evidence that bariatric surgery is a highly effective, long-term treatment option for type 2 diabetes in people with overweight or obesity. It offers benefits that go beyond what is typically achieved with medical and lifestyle interventions alone. The results support considering bariatric surgery earlier in the treatment plan for suitable candidates. It's not just a last resort for weight loss. It's a powerful metabolic intervention for diabetes. Dr. Griffin P. Rogers, director of the NIDDK, highlighted the importance of studies like this. He stated, "This study exemplifies how public investments in obesity and diabetes research can lead to real clinical advances and long-term health benefits for millions of Americans experiencing these conditions." In summary, the ARMS T2D study followed participants for up to 12 years. It found that bariatric surgery led to significantly greater and more durable weight loss compared to medical/lifestyle management. Crucially, the surgery group achieved much better long-term blood glucose control. They were also far more likely to reduce or stop diabetes medications and achieve diabetes remission. These benefits were seen even in individuals with lower BMIs. While effective, bariatric surgery does carry risks, including potential nutritional deficiencies and gastrointestinal issues. These require careful, lifelong monitoring and management. The studies found no difference in major adverse events, but specific complications like anemia and fractures were more common in the surgery group. Therefore, the decision to pursue bariatric surgery is a serious one. It requires a thorough evaluation of individual health status, potential benefits, and risks. It also necessitates a commitment to long-term follow-up care. For many people with type 2 diabetes and overweight or obesity, bariatric surgery represents a powerful tool. It offers the potential for significant improvements in blood sugar control, reduced medication burden, and even long-term remission. This study reinforces the growing understanding of bariatric surgery as a metabolic procedure with profound effects on diabetes. It provides strong, long-term data to support its use in appropriate candidates. This study's findings are promising, but bariatric surgery is not for everyone. It's a significant intervention with potential benefits and risks. The best approach depends on your individual health, diabetes severity, other medical conditions, and personal circumstances. Discussing all your treatment options with your healthcare team is essential. They can help you understand if bariatric surgery might be a suitable option for you based on your specific situation. If you have type 2 diabetes and overweight or obesity, and you're struggling to manage your condition with the current treatments, this study offers hope about another option. Don't make decisions based on this information alone. Talk to your doctor or endocrinologist about the ARMS T2D study and what its findings might mean for you. Ask about bariatric surgery as a potential treatment for your diabetes. Discuss the benefits, risks, and the commitment to long-term care required. Research qualified bariatric surgery centers and speak with surgeons. Empower yourself with information to make the best decision for your health journey.